Insulin on the black market.
The skyrocketing cost of the drug now has diabetes patients going to desperate lengths to get it.
CDC says more than 30 million Americans have diabetes, and just over 1 in 4 say they have reduced or stopped taking insulin because of the cost.
Only on 7 tonight, we are introducing you to a Birmingham woman who's part of the insulin black market.
7 Action News reporter Kim Russell went with her on an international drug run to show us how it works.
When I tell you this story is about a black market between the United States and Canada, you probably have images of drugs and booze in your mind, but it's about diabetics who simply need their insulin.
We can't even walk into a pharmacy and get it.
Jillian Ripalone runs meetups with people struggling to get the insulin they need because she knows what it's like. When she was a child, her parents lost their health insurance.
We were turned away because we didn't have the money at the time to afford our insulin, which is this little bottle right here.
That was $200.
This was $200 in the 90s.
She needed 3 a month. She feared for her life as her parents worked to get the money needed. Now she says the situation is even worse for many as the cost of insulin in the U.S. has skyrocketed.
So for my 30-day supply, it's $1,020.
Even if you have health insurance, you can find yourself without the medicine you need. Michelle Busticker dropped a vial on the floor.
I had to actually admit myself to the emergency room in order to be able to get insulin.
While Michael Cohen drove for Uber, he says a passenger stole his medicine.
Insurance isn't going to make up for that, so that's why I had to seek out to the black market.
The black market is a vast network of people who sell and trade insulin online. Jillian, in some ways, is a leader in it.
Because when there's a diabetic in need, you get it. You understand that if you can't get insulin, you're going to die.
Diabetics use different amounts of insulin based on their blood sugar. She runs a Facebook page where people trade surplus insulin at no cost to people in need. Many send their extra insulin to her so she can distribute it. This is a look at her black market warehouse, her kitchen fridge in her home in Birmingham.
Is it legal to just give people insulin?
No, it's not legal.
This is our life support. If we don't have this, we can get DKA, we can die.
WXYZ medical editor Dr. Partha Nandi says patients should ask their doctors for help before turning to the black market and risking getting a medicine that has been mishandled or bought from a country with fewer regulations.
There's no way you can verify the quality, or even if you're getting the right substance, or perhaps getting something that could really harm you.
Jillian says she doesn't just get medicine from her Facebook page.
We'll jump in my car. All right, everyone has their passport, their license.
She and other diabetics also can save by caravanning to Canada. We followed her on a trip to Yeast Pharmacy in Windsor.
I just called for a bottle of Novo Rapid. So here our insulin is $41 for a vial, and in the US, my one vial would be $340, and that's with insurance. It's worth the $5 toll.
As for why it's less expensive, pharmacist Richard Yee says it's because the Canadian government regulates prices.
Since government pays for it, it limits, how much they want to pay for it. So that's why our insulin is usually cheaper.
He sees dozens of Americans every month coming to Canada for insulin. He says Canada allows insulin to be sold for personal use, up to a 3-month supply. Jillian may donate the insulin she buys if she does not need it.
This is what people use to stay alive. Are you going to tell somebody no?
Kim Russell, 7 Action News.
Wow, eye-opening report, Kim.
Yeah, an important story, and it's one that if you need insulin, I guess you need to know about.
People are going to do what they have to do, right?
That's right.
Here's what we're working on for tomorrow on Action News at 6. Imagine calling 911 during a crisis and being put on hold. It's what a number of Detroiters say has happened to them. 7 investigator Ross Jones reveals it's happening hundreds of times a day in Detroit, with some callers waiting minutes before a call taker answers.
I said, okay, I never heard that before, so I'll sit here. And then it got longer and longer. The time got longer, the wait got longer. So it's about 5 minutes past or so, if not more, because it took so long.
So you called not once?
Not twice, but 3 times.
3 times? Every time you were put on hold?
Every time I was put on hold.
Tomorrow night at 6, how the city is responding to our investigation. Make sure you watch. Dave?